Hi, guys. It's Dr. Kaplan again. As I always say, my mission is to make psychology accessible to the public. And more recently, I've been asked to kind of give a discussion about what is mental illness. Based on one of the comments, I decided I would make a very short video trying to address what are some of the characteristics of mental illness. So here we go. So there's pretty reasonable variability in the definition of mental illness. But what you'll see is that while definitions may vary, the four characteristics of mental illness are pretty solid. So the four Ds, as we refer to them, are deviance, distress, dysfunction, and danger. So deviance, typically we're dealing with either extreme, unusual, or maybe even bizarre behavior. But as I will mention just shortly, just because someone has a deviation in behavior doesn't mean that in isolation is going to be a mental illness. We also have distress. So whatever this psychological condition is, it's unpleasant to the person. And we have dysfunction. So for a psychological disorder to occur, it has to interfere with one aspect or more of your daily life. Now, the first three of the Ds are found in pretty much every psychological disorder, but the fourth one is not universal, and that's danger. So some psychological conditions can result in posing harm to that individual or other people around them, but it's not every psychological condition has the fourth D. So as I said, deviance refers to some pattern of behavior that's considered unusual, different, bizarre, or extreme. And when we try and determine what is considered deviant, we need to know what the norms are. So a norm or a cultural norm is basically the implicit or explicit rules of conduct that are established by a given society. And each culture might have different norms. So if we're going to evaluate an individual in terms of what's considered deviant, we need to make sure that we're aware of their culture and the value systems within their culture, the rules within their culture, before coming to a determination that their behavior is deviant. So we always judge people through the prism of their culture. And then obviously, situations matter, understanding the context. But I will say that this is one of the criticisms of the DSM, which is the manual that we use for identifying or assessing and diagnosing mental illness. One of the biggest criticisms has been that it is culturally biased, and it takes more of an American-centric perspective. So that is one of the controversies over the DSM. But I will also say that as the DSM has progressed, we're now in the fifth edition of the DSM, it has become more and more culturally sensitive, and that has impacted what's considered a psychological disorder. Now, so deviance alone is not enough, right? So we also have to have distress. So when we talk about distress, that it refers to some kind of behavior that's unpleasant to the person. Usually it's unsettling. So if a person is diagnosed with depression, they might withdraw from friendships, and due to the loss of social contact, they might be bothered by the fact that they don't have that social interaction. Now, there are many behaviors that are considered deviant but don't involve distress. So I like to give the example of the icebreakers, or you might hear of the polar bear plunge. Uh, that is not the typical behavior, but when people who are part of these icebreakers or polar bear clubs, they get a thrill and excitement off of going into cold water because it is a reflection of, their strength, how much they can, withstand, and it builds a sense of community. So just because something is deviant does not mean that it is entirely a psychological disorder. Now, so we do have distress factors that are involved with psychological disorders, and it's possible that the person may not be aware of the psychological distress, but other people around them are. For example, when it comes to alcohol or substance abuse, sometimes when people are in the throes of addiction, they don't realize the damage that they're causing to people around them. So the distress usually is to the person themselves, but it can also be distress that occurs to people close to this individual as well. And then we have dysfunction. Dysfunction is, in order for a psychological disorder to occur, it has to interfere with one or more aspects of your daily living. So it could be interfere with your personal functioning, social, educational, occupational. So we kind of look at, how are your relationships? How are you doing as a student? How are you doing as a worker? Has this psychological condition resulted in legal problems or homelessness and so forth? So we go through various social domains and factors that could be at play. But again, you can have dysfunction without deviance and distress as well, in which we wouldn't necessarily diagnose a person. But the three combined, deviance, distress, and dysfunction, if all three are present, we have a solid case for a psychological illness or a mental illness. And then, as I said, that not every condition is going to have a significant danger, which is a potential harm to oneself or others. So we're talking about the potential for suicidality or homicidality. So there are conditions that have higher rates of danger. Things like depression have higher rates of suicide, and schizophrenia has a higher rate of homicide, but not all cases of abnormality or mental illness comes with danger. So a run-of-the-mill generalized anxiety disorder would not necessarily have danger. Now, I figured I would tell you the prism by which we look for a diagnosis, but if I'm going to be intellectually honest, I also want to talk about the movement that opposes diagnosis. So one of the criticisms that Thomas Szasz had, which is one of the leading critics, was that when we talk about mental illness, it's dependent on the social norms, as I said. So because it's socially constructed and culture impacts our understanding of what mental illness is, the whole concept of mental illness is invalid, according to Thomas Szasz. And instead of referring to people as having mental illness, he refers to problems of living. And another argument that's presented in opposition of diagnoses is that societies oftentimes use the concept of mental illness to push back against individuals who violate social order. So that, in a nutshell, is what a mental illness is. I will tell you, as a clinical psychologist, we treat people, we don't treat diagnoses. So it doesn't matter what the label is. More important is are how this condition is impacting your daily life. But now you know what a mental illness is, and at least one of the criticisms of the concept of diagnosing. If you like this video, give a thumbs up, subscribe to the channel, and that will allow me to provide more up-to-date content and give you what you ask for, such as this video. I wish you well, and until next time, people.